If you suspect asthma without wheezing, here's what you can do. Track your symptoms. Keep a diary of when and where symptoms occur. Ask about a breathing test. Spirometry or a methacillin challenge can confirm airway sensitivity. Consider an inhaler trial. If asthma is suspected, your doctor may prescribe an inhaler to see if symptoms improve. Avoid triggers. Common triggers include allergens, smoke, pollution, and cold air. Check for reflux. Managing GERD can sometimes reduce asthma-like symptoms.